mostly kwano ane baba behwe wo memu no your friend of pelvic inflammatory disease ane PID de bia na me sure say ma bebre na ati PID say ye kutwa scan say ye labs ni bibia de bia na kan wonya PID so it become a common name, and sometimes there are lots of ladies who are having it. For instance, like I said, saying fertility no more, they try to ignore it because they feel so shape. But sometimes left untreated, no could also still give you those same problems with the bladder leading to the kidneys as well. And then we are going to look at it from that angle, not necessarily on fertility, but we're going to look at it from that angle. Yeah, but fertility about me as well. But I know the Emunia Sebontin, Yabekwakoje, Yabua from Kratos, Sessinamoni, Sisia Brunia Eba, City Gold Jewelries, Omakola. They have so many fantastic things. Watch here, Shemi, and City Gold Jewelries. And my ring will be in him, City Gold that before Mabi. And you know, after several years of marriage, look at how clean and how glittering it's still. The last time Kwampa me paper and Buddha. And you do so, and those are the joy you have when you shop at a good place. They be all your things are intact, all your things are looking shining and nice. To be also show me, bro, you young to be out of be say watch papi be say bracelets, say akomade, asumade, that's the necklace, and then maybe earring, something nice for your loved ones, your software, obia, afimu, the person has been very good to you. Unyanka obeda nase, unim say sikadi ebi ni hontin, unyanka obenya bibia, ebe sum ne boa, de bia nipa ni sha, obefa, obeka say osimesi no dia de ma me no. And I recommend City Gold Jewelries and more Christmas affordable things that their things are nice and of good quality as well. Koko GBB was City Gold Jewelries. The okwa kase o share health talk show near you recommend them out. There will be a discount for you. Just go there. Get something. Royal Natural Health and Wellness Clinic and Royal Natural Health and Wellness Clinic. The Obo Mudina. Obi enim say asad now. The Kofu Pina face a Royal Health Clinic there. A Ma Clinic, a War Clinic. There be Royal Natural Health and Wellness Clinic. We take care of everybody. I want an ayaji din woman and I don't know say I won't quantino because sister my dinner I won't buy an internet utifi. That be over the weekend we had a nice screening and we had a lot of people coming around. I think say before we wrap up we're going to show you some of the pictures and activities. You can as well go to Facebook and then watch some of the interesting things that Royal Natural Health and Wellness Clinic is doing for the community and then for the people at large. Be a share me. You would want to also visit Royal Natural Health and Wellness Clinic this festive season, and there are going to be special packages as well for you. Just to an amombra, TV so and Kwampono would give you a discount in terms of consultation. And then if there is any other thing to be done now, say lab now be say scan now be Royal Natural Health and Wellness Clinic. Ye be wanting the here say wabaho. Now only doctor na bonkomo. No account yare. Say labs now also ya. Obema wa lab no. Say scan also which say which scan. Say if phone also we are. Obesha say which me I say then yeah offer massage services. Inti bi na won yare. But be a Friday be what bread. Which no don't pay wonamu unya sa Friday nyube no obe try se bia obe bana ya ma massage fine one bi na odi akwakoda anampo Saturday woni bibia akono anapa no tumi ba na baba beji massage papa bi dia hwese bibia yoka. We offer all the forms of massages no and Auntie Betha and the crew are there to take you through that therapy. So you will be a friend a happy hour in terms of what point ejuma na bia wo kofi na obe hia massage kakebi ansa na wakwa den wakwa odi akofi na odi akwakoda no. I like their massage services. Massage we are now odawa. Sometimes you feel like a baby, you know. I recommend say also be to and more from Thursday, happy only Thursdays, Fridays, and then Saturdays. When you come, they are going to take good care of you. Just Royal Natural Health and Wellness Clinic. We offer all these services there. The Kenyans says I'm kind of Abeka, La Paz, and in the environment media. You can just walk in and then get it done. We have special services. Yeah, baby, Christmas here will be a friend in colon hydrotherapy. And Madam Esther and the crew. Say be a woody dimanasha also. Say be a wo bedi bunyo nyanka. Be clean system. Actually, say be you okay. And son out the rough if you no Esther and the crew no. We call it the colon hydrotherapy. See, I didn't sue and abe for form of asa. Say yeah, baby saw. And make sure so you okay. Titinana, yeah, my member side the bent and we've modernized it. And that is what Royal Natural Health and Wellness Clinic are offering this Christmas. Those are the services, the massage service and then the colon hydrotherapy, are the services we are recommending this Christmas for our viewers. So Benyamre, no idea. Well, we two and more about near show, near say also then because we do need the services and then we provide that service for you. And they are discounted this time around for the Christmas festival. Just make time, just come around. Let's see, say then and a so or a brabum, then or see a edible. And yeah, we are phone kwane barrow. With what I've told you, you can just come and get this therapy done. You can come with the family. Only Christmas, you just come in and get this thing done, and I'm sure you enjoy the Christmas and then the New Year. You betcha your own aquacoji omunkrato eba. At the end topic no eden a new casual. Thank you for my outfit and a new casual dance woman runabout. So also pese brunye ube pam be fine and ube no family no year no ka from be pam be fine. I share Christmas here and a new casual. The frame na mano ofra, I'll give you their contact and then you go to them. Yencha onkojo omunkrato ambrasisia.
Wedding or any occasion, make it special. Make it City Gold. City Gold is the leading gold hub in Ghana that makes special moments memorable just for you. Do you need genuine gold jewelry and accessories like earrings, watches, necklaces, bracelets, rings, and so on and so forth for that special someone or occasion? Do you need assistance in choosing the best wedding and engagement rings? City Bridal, under the auspices of City Gold, has everything that will complement your desired wedding gown. We have in stock all you need for your weddings, bridal showers, traditional marriage ceremonies, accessories, and lots more. Remember, our jewelries are specially designed to meet your budget and your taste. For wholesale and retail, call us now at City Gold 0302 906 750 or 0208 150 679, or locate us in Accra at the Makola Shopping Mall, 5th Kojo Thompson Road, right here in Accra. City Gold, home of quality jewelry.
Yamamu Akwa Baba Rural Natural Health and Wellness Clinic. Session Yamunim Rural Natural Health and Wellness Clinic has been in session for quite a number of years now. TMPC, am I a license? We are operating as an alternative medical center. So BBA, AOBA, say a woman, say a infection, say then a yo, say be a yaro. Na opese oba ayaresabia na ehwe no Rural Natural Health and Wellness Clinic your comprehensive lab ewa ha say bibia ye obi a doctor asio anase woko bibi mpuni aka chose Korani Medicals empo ebra na utumi ba Rural Natural Health and Wellness Clinic ya so ha ebeba berane yo bibi sunkron ha e friend colon hydrotherapy say bia tete no na yesta esa anase tete ni say bibi ye wa aka chose bia yen mixing niama ni yemfa ensaw sa niama ni nyina ye won abefo kwan so Rural Natural Health and Wellness Clinic ha mo say bia wapon anase wakọ adwuma waye adwuma na wo ho hensha dan fe enye de bia na wo se bia wo se wo da edro so bi na nanka ohia massage kakra anase bia woni doctor bonko na se wo diet anase exercise bi mpo na o chiro na nka okọ mu a enka be den ebe ma wo ho ato no etumi agina wo ho na mu so biem na wo ho ayeden na nyina no ba Rural Natural Health and Wellness Clinic ayo a doctor for her omo ne mo be bon komo be chirechiro kwan ya e wo se wo fa so nyame wo se wonye nyame wo se wonye se mo pe awompo na kwan ya wo se mo fa so na amawo no ebebe mu se bia ye betwa scan se be oba anaso oba mampo ye be run scan actually say o prostate anaso se bibi mpo o testicle anaso bibi touch mampo even the abdominal scan bia na ya chire se kokorani bia na o kwa health insurance anampo se okwa korane test bi ni esi of scan kan no Rural Natural Health and Wellness Clinic a yitwa sa scan ni bi wa ha oba ye betumi adan yitwa sa scan na ma ye wo health professionals wa ha omo akwadra wo omodwuma omo ye ni mu ye wo pharmacy so a oba pharmacy ndru bi a ehu hia se wo se woto se bi a ya suma se brabeto anase wabampo na doctor na prescribe bi ama on ye ndru ni nyina no FDA ahwehwe mu a eye mapa a wotumi adan ekọ pharmacy ekokoto now you're the onom na oho eto bibia here obi bibia e kire wadwum bia Rural Natural Health and Wellness Clinic no ye wo Abeka La Paz post office bibia ofi ba bia no fa car na catched mate ni say obesi wo Abeka post office udu Abeka post office a obo Rural Natural Health and Wellness Clinic ye signboard kes here e green and white building mu just walk in then how only Rural Natural Health and Wellness Clinic and bonkomo Rural Natural Health and Wellness Clinic ye say wa pomoden ene wa hunya. We are actually for an essential Emma Kwaba Keshepamba Rural Health Talk Show. So, and before we went on break, like I was saying, we started a discussion concerning kidneys, and then we're looking at some of the basic things that we ignore as individuals before the kidneys set in individually. And one of the major things I was saying in men was prostrate, or maybe when you're prostrate, or I feel it's normal, or you're a bit treaty, no, I call you true way, no, I call you in some way, no one thinking so, you're treaty, or you're way true, or you're share your way true, and the gown say one way or dido, because one no, or no, no. No, and I oh, in a kidney problem, say a miniba, kidney, a mini no ni, ona, dana, we be kidney, because ever fit money, kidney or no neighbor, dabi. No kono fe ni bi kuma no temi dani hani kidney femini eba e wo je ni eba no ni eba affectable na kan da bi o temi bi kuma mi ni bonu no mi o ya ni bi emi o jomo po ba anje me agashi o na kani na eka eba ha na kidney lapo no mi o le no ji no ni ya no asema make me come on me boy before you call break no na make no enkran kase mu no say sometimes emre bebe no obabi wo ho so o tipens bi we na ya ase oh I know so bia na e mayare ana bia na ne menses nimpo ne pese banti na wa ignore obeme bi wo ha ote odwunso ote yaw no wa call hospital says am kan last 2 weeks na wa kwakoye no with we as member no ye taste atinke bi wo ye be me bi pani afiso oh menya infection tina ne call hospital ye kwa na kwakohwe say infection ana ye kona say ye infection pa when the enye hwe na wa ignore enso bia na bibi fufuro na ebo nkaye so I say yare bi na eba enye gono you know, so sometimes with men or baby boy oh me yes sex die in a while oh me cry saying sex na dey not why ignore say na Dr. Clement can no baby or feel so enye hwe or sorry but on yes sex in a while intino or feel so enye hwe it should be a normal urinary tract infection be UTI be oh school campus washroom be a use general washroom be a you have a low white blood cells into ma when you're infection from maybe your colleague, it is not sexual. It's not feel normal or bad they will insufficient cry if you was normal or bema the unya infection be a normal. You understand? And then you take those things as normal. One have to stage be na or sobana I prolong it to pelvic region. To be our hospital. I saw say my producer plays this thing on the screen. And my baby now say oh she screen so me sure say what hospital my you trust scandal when we image be say so we trust scandal to me quickly no share me na say we trust scandal to me go for scan report now she won say na you project BB niam na you project screens go na doctor acho so BB say na ayo you trust scan na acho say BB say and na ekoso anase BB say na kire intesa na oso hu ana o feel say oh doctor ne say oh asio nsu na wo ade na wo white na ono insufin bi na ebekọ na acho so pelvic region no na ayesa when doctors explain e kire nema so you might be saying say oh we dey ni acho so we say no say oh we say oh na we you know one interesting thing so we oba na so wakọ ayaresa bia na akaso oh PID da you should be very alarmed and as we scan po na image here that screen issue won't be scan we more you should be alarmed kakra but many a times say na me kind no so your young lady yeah now expect ya wo nye ha wo hwe baby ya aro na me sure say ma bebe nature scanner ye hu bibi say ensuo ni we no whitish we na ye de aro na to so no when who be doctors actually so when a problem no when a problem be na wo de end quite unfortunate say senior Dr. Clement Kanu only obema bi mpon hia eda intine enhye da your problems how feel so we be anya hwe and I say senior mekan maybe I just 25 27 years 26 years 22 years intino I work rampo no enhye da anya bibi a wo dwen hu sesi antino enhye da amfa onti e boss ma no Dr. Boss we ka say we nya PID no you've taken it to and the anya hwe PID basically I'm sure say I say basically has to do with an inflammation within the reproductive organs or within the pelvic region, no, you can pelvic region, you can about the uterus, you can about the fallopian tubes, you can about the ovaries. Those are the places we look out to when we come for when you travel scan. You can say when your PID and I said the pelvic is inflamed. Those are the areas we look out for or you share as an individual. And normally, like I was saying, when they show those images to you now, what the doctor will tell you so when 2-1 a month one share what will be problem and now suppose you might stand a chance of getting an ectopic pregnancy and now say Dr. Becca so you might begin to have chronic pains and those are some of the signs and symptoms and I'm quickly whilst I'm trying to say let me go to it and then explain it to us so when you PID and now now try scan put that into when you be and say let me just say the signs and symptoms. The first thing you should look out for is pain during sexual intercourse and then pain during urination. Say bia ono hoka fu shia na what yaw. Sorry, but it has nothing to do with the size of the penis. You understand? But what yaw be say sorry to say you are feeling some burning sensation during the sexual intercourse. Anampo moye sex we no what say oho why say ehihye kakra enye vagina no but why ask no say you are feeling a little discomfort after the sexual act no. Anampo bia na Johnson Adam o de Johnson ni hye ho kakra eche ema bebe na o so me twen bebe am woni ye fa intimide hye me ho intime kofia afi o de hye ho kakra afi o du fie na o try say o Johnson no I say ya obi e wo Johnson echi intino o de ma o dwen an say ana say me de Johnson ni hye me ho fiti time na ba bedu entina ma meti ya na na number 1 enhu na nka hu nyampo so de be hye ho bado de anya hwe de ahye ho ba afie no o Johnson no afi o ti ya kakra Johnson no eba no o ti say sorry to say o feel the day kakra bi you are feeling say it is not just the normal common release on what to say o Johnson but I say o feel some burning sensations and tingleness be whilst urinating anampo no wa o your ba na what is some sharp pain oh why I say sharp pains oh uchi usisi ichi some sharp pains around your thighs, some sharp pains around your knee area. Otis are pains ni na otia. Now I ignore we all feel so and I'm menses in the peseba and I your breath and I then put in a mintina ma may feel our pains no. We are banner or feel this kind of pain. Menstrual disorders. You see, fine, like I said, no, when we talk about these things now, our major thing is that we are fertility, but bona women's is not say about 7th. When have 7th do na amma na ba be 10th the 3 days be aba be daso e ba sana say if you've been sexually active I become a bit worried say be women say na onyima na so wa kwatwa scan na onyim ana obey test na enyin you should be alarmed. We oba menstrual cycle we explained once upon a time say I was say ban on the 28th day aban tem cry 21st day. But all the any day, every 14 days, every 10 days, biano. Now, omenses aba. Omenses ambampoa, some sports and be, some blood be kaka. You see all these things. Omenses at first nabia eba ye, but this year I start be eba so eba very scanty. Oba now all these signs are mabobosua. Pain during sexual intercourse, pain during urination, burning sensation. One thing, frequent urination. Kakrana Johnson do. O Johnson we often say Johnson no ebi I den aka. Tina quickly no. Wasan so ako. So ako Johnson. You understand? Inti we oba na o feel this signs ni nyinara na. Be out there like I said, you have not been sexually active. So o feel so. Be na enye hwe. Normal. Or now you have some discharge, you are not ovulating. discharge sometimes is brownish, sometimes it's creamish. Then you just ignore, say, oh, normal. Then you get to a stage. After you go now, scan. No. Now your mouse scan like the one that was projected. And so when your PID. Yes, oh, a infection be na mana basa. Inti no hu sa na afi o dwen say then e kofa bae. Then e man bae. Say sinam kan bia o de untwa scan ni bi da. But nyama mabobo su nyina no. Unu say ebi ekoso, you feel it, you see it now. The moment you see that, and just know, and that screen is no. Maybe the uterus is inflamed. Maybe your ovaries are inflamed. Maybe your fallopian tubes are inflamed. You understand? Until say we just scan womb. And let me just say this thing. Sorry, but it's not like I'm debunking somebody's business. Sometimes ubo call you so ade bi mu ade na we sum no e be kire say o pelvic na. Mr. The best is to take the scan, either the pelvic scan or a transvaginal scan. You understand? They use the probida on your stomach or they do the insection. Any of them. And no nebema you say you are battling this kind of thing that was on projected. No. Tinibia wakona ya scan amount. Then the doctor will take time to explain things to you well. Then the midwife or the sonographer will take time and then explain things to you well. Say problem awukomui. It is what we call the pelvic inflammatory disease. A conferred by maybe through sexually transmitted infection. When things like this are happening, they don't happen overnight. And yes, only before the pelvic gets inflamed, no, now it take it through a procedure. Normally, an untreated sexually transmitted infection, a bacterial infection, a urinary tract infection. I'm saying this thing so that you get to know, say, and yet sex pet, that's a sexually transmitted infection, a pet. But when you be, and know right now one interesting thing, we'll be back and go see your dog, meaning the area until the moon pay do be mamma. And so we always go straight to the pharmacy. Oh, we see the medical counter assistant. We go and see Abigail and the crew. Then, metro a drum. Oh, you go and see Mpachoma me draw. Then, say na yam then I mean no mama we draw. No one no. Oh no me na yare ko. After be 1 month na sensual as a face beam. Oh, no sensual. But you know, it has become so normal. It's become so normal with Ghanaians that me kocho a draw we no. Any say a year way into no. For infection. Say me kena PID abi. Me nye bi into no. Na me koto no na me the box no akwa akotu fie onko hospital enko twa scan interest o ampa me twa scan mpo no yesi me PID na call ana enko ye doctor ndi me to dose for 14 days and I said 10 days man me do na wie or say me call back to doctor no na doctor ni twa scan interest o bibia akọ afa why okay and I say bibia enko ye nti to eduro no so kakra na ye ntwe say ohun beto ana say or say you take the next action. Or starting so no me drone day 4, day 5, no say I say I'm home to me kakra. Discharge na ko. Discomfort no ko. Sorry to say sent ni na never no to or discharge no. Ni na bibia easy. Intin ka also or back no. No ko keep a drone ka na aka no. We jay a drone no. No ko keep a drone ka no. Oh baby. Na fi no bra bra ni mana. Ya na sanso ababiem. Na ndo akwa hwehwe duro no yi no start etu aso to no mia na esan no na kpa o de ko pharmacy hello auntie acho me duro we bi na o si na wato no asesa na o de ma na o de akwa akotu fie na ono wato so maybe in this continuous doctor no ka ko hu doctor na time na o de otu duro no so wie na ka onum wie ya enka a case or has been made, some completion of medication have been made. If there's even the need to return some of the drugs now, you could have returned it. Nanso no sister enom ye no hu se no to no den kana kwa kusie 1 month time 2 weeks time ya na sanso a start say manifest bim no akofa ofa no so aka 2 penny shim say no afa box no e dey call medical counter assistant no ho or dey akire no nipa na ma na edro no waje or akwa fi or kotua edro no so anom trese ne etena with the notion say no ho better because no miem. So now it becomes a cycle oyare na anu akofa box no de akọ ni asesa man oyare no akofa box no de akọ ni asesa man oyare no de box na akọ ni asesa man nti wabenum edroni sa. What you are doing is that now you are making the drugs get used to, and the fun part of it is sometimes they then become doctors themselves. They then become medical practitioners themselves into or to come. And I always say this thing. Remember, I mean, for me once because I say, "Omuko meko na then." They say, "Oh, do when a boy me ba no ntu so jikotobie." Na say e ja phone na ba no boni afre. Oh, I tell me, do na last so chem na we trap picture. No, they are sending no. No, so they are pharmacy no kwakoto. No, they are man ba ni say genom na amanom ye no. Boa ni nti no. Oso koto nanom ebe boa. You see. And it's become the normal norm. And you draw back on a doctor prescribe ma atama me no. Atama me keep you no. We try picture. E dey ato medical group no mu. Ti medical group no bia kwa kotubi. E dey fie. Ne bayare ye na no we ama no gimie no no. And that has become the normal norm. And we keep doing it. Enti no oyare a so nka obeka so yare a me feel mame nko hospital nko hwe se den na ekoso mame nko me interest scan enhwe se den na ekoso mame nko lab na me hwe se den na ekoso. You see edro na doctors edemano sometimes we do the body mass in less time ye share na bia you modu ye man 500 mg onum na anopa na enyubre for 5 days. Yeah, Philip slim Philip body mass no onu be nya bia just 700 mg once daily. Inti ni me yakase me fa ba kwa na pa ba kwa wi ba kwa nyugbe no bia wo de no ka be fa no one daily bia na wo de no be fa no twice daily. But because me ko to no doctor ne ka say me num ni say no or the mind the next person no a chance me fa ni say to so tia so fa ni sa. We are discussing kidneys. Like I said, we are not doing fertility. That's why we are doing a little tilt in terms of PID. We are looking at the kidneys. And it's not tilt and communicate. So the abuse of that particular medication, and then the transfer of medications. Timiji na menumi na eje na we numbi. Now we are to so sometimes we na a WhatsApp group. Ti yare ne ba no nipa ba kunya yare na onu medo we na eje no. We know share. Oh, this medication is very good, pound. You should try it. Then do be to be. Sometimes we will not be afraid. Oh, doc, can you tell me more about it? I'm like, hey, no, we go far from him. I'm like, oh, madam, for be or see a young man. Annie, I am our down for be no. Sorry to say, oh no, chrono was no near more also. There are some medications that are prescribed. They can use it. Be no, or no, they do in the breakfast. The lunch in the supper, the name be na woody. So what I say, and it's high in a particular substance. What do you know who didn't has that substance already? Now if you say it then put pressure on the kidneys. Then put pressure on the kidneys. To want to be a power. After I want to buy no, now there's complications in pregnancy. When I feel na I want to buy, but you when you diabetes. You say, eh, na so eden yare me kofa fi hi na ya wo na opete ba nse na diabetes ya be mu endro bia na wo nom therapy bia na wo ye. You know, and this therapy thing has come. Sometimes we wake up in the morning, no be sure me the engineer to nsuo shemu, me the way ankatradia ka ho, me the cinnamon kakra ka ho. And sometimes you ask them to go sua fi hi, or so you be na no ye. Oba run natural health and wellness clinic now pay a diet plan. I see, I always tell people there's a difference between a diet plan, a weight management plan, a cholesterol treatment plan. In TPL hospital, so you have high cholesterol. It's not doctor do what to a drobi so. No go down for be on no gym. Why diet plan? On only the plan and then your weight management. Also the yes, who call your lipid profile. Yes, total cholesterol no say. Inti jai ready. Ono so jai wedi to on yan fan say obi wo say menom almond milk for weight management. Also should be you are lactose intolerant into your child say men no milk crampo. But then doctor what about almond milk say and there purely herbal. Miss sure doctor no any madenti or the way to weight management so. And I will treat a lipid profile do so. And you know, they are two different things. My ensheni has the same thing. Obi a when you diabetes are treating no. And you be a sorry to say no more do oil weight loss. They are two different conditions. And yet the same condition. Into you go online, no be a shake be, obi a smoothies be, obi a baby. The doctor ne recommend the man. Oba Rana Charles and Wellness Clinic, Dr. Debo, she can take you through those weight management on OS Slim. She knows how to do it and maintain weight. You can eat every food and still maintain that weight. She can take you through that thing. Oba na say beautiful for na weight management and na open so yeah, she can take you through. But say Oba now go online na be a royal, you put some nice recipe for Christmas. Says na make na be a yakazo we this Christmas chicken na ohia. Nti be akoda farms na kokoto chicken no na fire dem. Fire with duane. Be no be so yakayen so Christmas way because of weight and identity abstain from chicken kakra. Can you do lean protein? Can you do this? Can you do this? Na ya che. Inti na esro bia de idea ma no. Inti men kon ko fa obi de enga say eh ahani ya tro say anapa no edro no so nom ne 3 times so. Anapa mienu, ewia mienu, enyubre mienu. Enti no na wetwa na wase ni pacho oba to edro we bi why. Tiafi o sister so start so complaining so misumenya PID. Misumenya pelvic inflammation ni bi pe. Na ndo si o madam fu bi sending ade we group bi a na e wo so school. Madam fu bi sending we o si edro we bu apa. Na ndo hwem wofo ede. Na ni pa nso akwakoto. Information are good to be shared. But like I'm saying, let us know your condition. Let us know what is wrong with you. And when we are sure, we are confident with what we are doing. But so bad with medication, so and sometimes they start the conversation nicely. Me told you do last month, no, a boy me pan, but she said, "Me no, and boy me be a meeting and my baby said, my baby said then so the person has come and confirm say do no so no and ask my no. Nipa na ma clinic. To obasa na catch nipa so. Koela bra ni enhwe de ye o say oh doctor. Say my catch you say na do we na me no because of your highway. And I mean no me aje me but say an engineer you should know say angel no. There could be something. There could be something. Sometimes we understand the economy. We understand how things are. But say 30 cities, say 50 cities, we now called Bell Lab. May you know exactly what is wrong with you. No, a bet you won't qua. A bet save you kidneys. No, that's so you have 400 Ghana cedi, and I said 300 Ghana cedis for dialysis 3 times in a week. No, 2 and more. 26 years. Like I said, Rana Charles and Wellness Clinic, we are known for fertility. Oba bi ana ya wo na ode ba ye. Ye ma mema bibia obenu ma afi nyame adom wawo afa ho afa oba no na ye say pressure ababa beda oso because wonyim no mu no nduro ne ade na ono no mi ana say o system no ama say ano wawo awiembom na nka afi no so ojiwe ni no obehwe say akran be ko school ni ade na afi na ode ba be treat diabetes. So let us know what is wrong with you. Brian Sabia, Rana Charles and Wellness Clinic, like I said, I'm not more fat to say, you remember home-based TV. We will pay and speak to our viewers on Saturdays between 7 and 8 p.m. to let them know, say, this is what you need to know. This is what you are supposed to do. And I'm on when also too. When also here. Into what we share. So we are here. Just call us. Your numbers in that screen, so you can call any of the numbers. Speak to us. Let us know what is wrong with you. Let us take steps in making sure that you are good. And those are the best. My young say, these are conditions where you be treated. And you know, I like it when you go to Mokola, like, you're better treated. Okay, about treating here. Then how do you treat it? Obeying a drum pass or so. And at least nowadays with the learned folks, the answer no go. No go. There was a 25-year-old guy who came so prostrate. Some people will come and say, Obama, fine, OPI will be an abdominal pain, a low abdominal pain. But I don't know just what PID as Bema. PID in a pelvic inflammatory is a member, you don't have a pelvic. Until you're man. So go online now, Coco Kind. Now recommend you a Drobimawa. You go to places and then you sit and then guys will come to talk to you. And the medication they are on are hormonal drugs, which are not even for men. And when you ask, it's like, me who online, sometimes some people at the gym, some people train with it. And where you're married, you're trample for women. and so you menuma as obema, you might be causing some harm to yourself somewhere. Joe, but there are some implications, some complications you are going to meet in the near future. See, I need the Joe. You understand? It's a who be here say we your bar, we a bema, work hospital. Now you have some condition. Now we treat you and your medication. It is always recommendable say go back to your doctor. And yet they be never cover the counter to do. Sometimes you need to speak to somebody. That's the reason we're Natural Health and Wellness Clinic. We have come to you this evening. Just call us. Let us know what is wrong with you. Let's see what is going on. Sometimes it's best you walk in. Like I said, last week we had a screening. It was free. And we had a lot of people coming around. And it was nice seeing people come, talk their conditions with the doctor, talk their problems with the doctors, and then we try to get solutions for them. And it was all for free. Fine, what you mean friend am no? Ni hu de betumi aya den e de aboam. Bia na wo Accra. Obi o so otikaswa, obala pasa e den ma no. Bia na wo yare ntia. But if you are sick now, say oh Tamalekra, I know say you would come. Men China won't do that stage no. To anamombra, ni ehwe say den na ekoso. Ni hu de betumi aya ma wontem. Betwa yon akwakoji abo from Kato eba ye baba bebo ni nyina tofa ni etie mo so mo views messages am sending questions am bisa on both our social media handles and then on WhatsApp no we're going to read them and then get you answers if you are be ahomatro no so na so afre na bibia ye bo so a unya nka be bo so biem no why then we bisa obetumi ahwen bia na upi anase okubebi opentema you don't have a problem. We are on YouTube, that's Home Based TV. We are on Facebook as Home Based TV. You are on X, that is formerly Twitter, as Home Based TV as well. So when you click Home Based TV now, you can go and then watch a repeat of it and also even continue from wherever you are watching from. You can as well go there, watch it, and then share the link with your friends as well. You try Yonkoji Abua from Kratro. Eba continue. Yonkomra here. Yamamo Akwa Baba Rural Natural Health and Wellness Clinic. Session Yamunim Rural Natural Health and Wellness Clinic has been in session for quite a number of years now. TMPC, am I a license? We are operating as an alternative medical center. So BBA, AOBA, say a woman, say a infection, say then a yo, say be a yaro. Na opese oba ayaresabia na ehwe no Rural Natural Health and Wellness Clinic your comprehensive lab ewa ha say bibia ye obi a doctor asio anase woko bebi mpuni aka chose Korani Medicals empo ebra no utumi ba Rural Natural Health and Wellness Clinic ya so ha ebaba berane yo bibi sunkron ha friend colon hydrotherapy say bia tete no na yesta esa anase tete no say bibi ye wa aka chose obi a yen mixing niama ni yemfa ensaw sa niama ni nyina ye won abefo kwan so Rural Natural Health and Wellness Clinic ha mo say bia wapon anase wakọ adwuma waye adwuma na wo ho hensha dan fe nye de bia na wo se bia wo se woda edro so bi na nanka ohia massage kakra anase bia woni doctor bonko na se wo diet anase exercise bi mpo na o kire na nka okọ mu a enka be den ebe ma wo ho ato no tumi agina wo ho na mo so biem na wo ho ayeden ne nyina no ba Rural Natural Health and Wellness Clinic ayo a doctor for ha omo ne mo be bonko mo be church kwan ya e wo se wo fa so nyame wo se wonye nyame wo se wonye se mo pe awompo na kwan ya wo se mo fa so na ma wo no ebebe mu se bia ye betwa scan se be oba anaso oba mampo ye be run scan actually say o prostate anaso say bibi mpo o testicle anaso bibi air touch mampo even the abdominal scan bia na ya kire se kokoro ani bia na o kwa health insurance anampo say o kwa korane test bi ni esi of scan kan no oba Rural Natural Health and Wellness Clinic ayi twa sa scan ni bi wa ha oba ye betumi adan etwa sa scan na ma ye wo health professionals wa ha omo akwadare wo omodwuma omo ye nemu ye wo pharmacy so a oba pharmacy ndru bi a ehu hia se wo se woto se bia ya soma se brabeto ananse wabampo na doctor na prescribe ama on ye ndru ni nyina no FDA ahwehwemu a eye mapa a wotumi adan ekọ pharmacy ekokoto now you're the onom na oho eto bibi here obi bibi a chire wadwum bia Rural Natural Health and Wellness Clinic no ye wo Abeka La Paz Post Office bibi ofi ba bia no fa car na catch mate ni say obesi wo Abeka Post Office udu Abeka Post Office a obo Rural Natural Health and Wellness Clinic ye signboard kes here green and white building mu just walk in then how only Rural Natural Health and Wellness Clinic and Bonkomo Rural Natural Health and Wellness Clinic ye say wa pomoden ene wo hunya. We are actually for example, Emma Mwakwaba Kesepa about Rural Health Talk Show. So, Anne says in a morning, no maybe between 7 and 8 p.m. No, is share a bon come off ya po modern Anne and there's also we continue on our discussion. Like I said, we are looking at the kidneys. Like one thing we spoke about last week was that the kidneys infections doesn't come just as like a sudden thing. No, they go through process. Sometimes there are certain things that we go through on our daily basis, day-to-day activities are things that would make or trigger the kidneys to continuously be affected, and then in the end we begin to have that kidney infections. Now, one of the things we looked out for over the past week is we looked at bladder infection, that's urinary tract infections. We've looked at prostate infections as well. We've looked at certain conditions that could cause the kidneys to be affected. Today we've gone to the ladies and we are looking at the pelvic inflammatory disease. One thing we learned in our discussion is that the pelvic inflammatory disease is a disease that is caused from a untreated sexually transmitted infection. Yes, untreated sexually transmitted infections. And when these things happen now, what happens is that it causes the inflammation of the pelvic. Oh, already we are beginning to have callers. Yeah, hello.
Yes.
Yeah, good evening.
Yes.
But you didn't be our face. But you on this kaka why not be okay, Prince. Prince, what you meet you? Amen, sir.
That's all. Let me show you the friend friend.
Okay, sir.
Yeah, me your friend from the TV in the home. Home base when I make him say, oh yeah, from trivia about health matter. But I don't know. Actually, Ghana for self-medication talk. Yes, anything conform to me. Koto abrewa ball mama koto say massage. They say a group be a man number 1 month in Asia Ediayemeno. The Yaro Minyare me koto duema. And I me duema. Not for the 3 days, no need to be caught rabbit. It's not Madame for less me be by the limiting command or trend say. Young Conan Koto at Groovy, a local name. Ochre na se yem kono yem koto maka ye koto azunu na ye tazunu bani 7 o'clock like this time mini I born 9 me runi sa na blessing mini from then this is my district kodu and cities and make cities and some me to koto every day me did drops almost 4 or 5 and sana me call hospital na mama me break too. And Ukraine, we said that the hoodie is a done. We quite do that. A grown on the common yellow, a grown Minyari bed, yeah. See 1 month equal to month in the matter. Because the first room, a young woman says, we done blackboard for. I see, because me is saying, oh, be so good, being over Tessie, when we I didn't see another with that. Look at you, I was here here to see. Okachia, no madam for Baco, so the animals are going to be but on social contaminant. When we see feeding to the only and a friendly kid, you don't know who is feeding to the I don't know how much is more time. Here, I got only a dear young now they said the number will be 1 month. said the agreement track me on the swap. Nasa. As a problem, children we are, your friend is health ministry, or muting so much. Said the publicity, everything are quite rich. Which you 2 hours can just a little enough. A dream economy. A true economy. Nani Shira. My family, my number, and the family is a big combo. What church and same woman, and near the price, all ministry, or multi so much, not multi call all the media stations. No matter what, the government, some of the cohorts return, not just a yellow. In the council of Bansapo, we have the idea also in there because I'm going to say actually. Our mobile money that I want to do.
Yes, I feel happy with what this man has just said. You see, baby now. You see, the drone says in your control no pharmacy, which means obi no economy. Doctor Nichire and be a dosage on phone. I don't know me, and I share senior all cano. And I'm sure there are a lot of people. And I'm not mechano. I use the word in Meku. You're sending warning message that. You see, sometimes. I won't say mama, but a mabi home. You understand? Obi wa okoto edro na onu me a ohun se no hoto ne pe not in kan kwekusie. Oti se ne sister yare enu obi twa ase ne no. Oti se obi yare enu obi twa ase ne. Mesro bra yare sabia. We are doing this publicity not like all kind is the government work that is supposed to do. No. Run a child and wellness clinic, you say you far to your own to say when you person ye. Yeah, man, me ton withdraw. Yeah, baby, share dear. And when you learn things like this now, when you sit with the doctor now, at least you have an idea what is wrong with you. You know what is wrong with you, and then you know the steps to take. But so if you live on self-medication, you live on and like you say, economy more idea man tino. They may call pharmacy park to do. Make sure they are not the area no, and you drop in a here. And when you come to Royal. One interesting thing is in kind. Sometimes obi beba no massage na dey na beto so. Obi beba no there was a patient oba clinic. Fertility no dey buy. Oba am kan say o no husband mo ye sex say. E ya da ho say. Ye say. So I say, "Oh doctor, na mo ama me edro me say o da bi. Unhie edro because ye check ye bibia you okay." They unhie an so be sound sex position. I say, "Oh doc, my ba hospital they use the fedro kakra bi pokita me kwa me fan che me kunu say my ba hospital." And that is the mindset of the Ghanaian. About hospital do here draw the alcohol. And with Royal Oba, your Abeka post office, the years will be too nice. Just come around. Let's have a chat. Since in American, when you come, it's just a conversation. I'm not the only one there. There are several of us. Regina is there, Philip is there, Abigail is there, Irene is there, Adepa is there, Dr. Deborah is there, Dr. Clement is there. We are all there for you. Just come. Esther, Bertha, we are all there. We are doing a lot. Just come around, let's sit down and then let's talk. Let's see what is going on. Now you want na more bed you be too ede aboa. Men if you thinking say we are no there is no solution. PID in the air camp. But like I was saying, no, PID in a cock fan yama be breed ba. Kofan same ba. And I man be brenano or baba ko yare no nya solution for edura. Na was spread the solution no. O body mass index. No could be different from the other person. To make sure say and among be able to be doctor and I recommend their way amount. 0501484671 0501484671. Also wait to me after BB HY wait to me after na ya bon money who let me read some of the messages that have come around and then we quickly pick solution. Okay, so Equia at the pagina, I'll say I'm watching you live. You know, Equia, good shout out to you. Thank you for watching. I really appreciate it. Richard also says I'm watching you live. Richard, thanks for watching. We try asking this or PID. Okay. So somebody is saying that she detected it and she's treating it with an antibiotics, but still now she's experiencing the pain. Okay, like this thing I've stated it before, and I think say in our discussion over and over, no, I've said it before. Say who treat infection, especially who treat infection. Na say who nya results are. There are two things. One, what caused the infection? If it's sexually transmitted now, are you treating alone? What happens to your partner? They say, who treating now partner in treating ya? Just know say you are just the key word is you they do yourself. Oh yeah, okay. Because you don't know in as much as you don't try to be treated, or partner no treating no is reinfecting you. So what happens? In the end, you don't know kidney issues. You understand? Know that, and then let's see what we can do as well to help you. You understand? And say who treat here? Be now there no a urinary tract infection. I will treat here. Are you still using the same panties? The fact that you are treating UTI, and it doesn't mean that you should just drink the medicine. Oh no, me draw no. Or panties, and answer or boxes no. I was say no. We will be our own share panties. Wonder where is now we share no. I was sorry they will try so best sano. You understand? Sometimes it's not only about washing and ironing. We go our share there for more than 3-4 months. Obi sure our jeans no and one no share ni de bia. Make sure it's time to wash it. It's time to wash it. It's time to clean it, or it's time to change it. If you are having an untreated one now, we recommend say obey them, but try as much as possible. Not we treat you. Let me see if there is any other messages about so that you can know what to do. Okay, menstrual bleeding. Okay. So this person is saying say bleeding excessively. When the message is about bleeding, though it is not part of the discussion. When you are bleeding excessively now, there could be an hormonal imbalance. There could be an infection. It could be say you are having fibroid. Any of those things no. Over Natural Health and Wellness Clinic says na meka ni atwa scan ewo ho. Nti ni betumi atwa scan ama ni hu say edem poti na eden eyo. Atwa scan na ye behu na ye do eden atu eduro so nti no de be hia say otu anamon waba clinic na ya hwe de betumi eden. Ya edi abo. Okay. All right. Okay, so I think that is it. 0501-484-671. That is it with the messages no. So if also should be chewa we here say explain my but then wait to me afraid now you the amount. And then like I said earlier no the signs and symptoms of pelvic inflammatory disease complications. Okay, let me look at the complications. Like I said, we are looking at the kidneys. We are relating our discussions to the kidneys. But complications of a pelvic inflammatory disease, an untreated one, is a topic pregnancy, infertility. So, PID now when treat here, and what one a bear style bisano, Sebeba say man, a being here so we treating to know. Unim so will be a bear good so beba clinic. Na ya share new hun debate to me I abo. When treating one, a topic pregnancy awaits you. When treating one infertility awaits you, you know, or banner or go through any of the pains near boss, any of the discharges near boss, any of the complications near boss, just know say there could be something. Then you take steps, then you know what to do to make sure say you are okay. Good. Things that we're going to end our conversation here. Like I said, Royal Natural Health and Wellness Clinic at Daroma. And a discussion with bro. Yeah, clinic. I or Abeka La Paz Post Office. We a theme of young, vibrant doctors, nurses, and health professionals. Yeah, you all run a Natural Health and Wellness Clinic. You be your point at all. Like I said, we don't come here to advertise the clinic. We don't come here to advertise the product. We come here to educate our viewers so that you can also make time and then come to the clinic. We sit down to talk, to get solutions to the condition you are going through. And a brand new bonkomo, you dear yo, near who the bet me idea at the abo, yo Abeka La Paz Post Office, which me friend ye, Memenama 023 115034 023 115034 and now 027778590 027778590 and also you can call any of the clinics numbers as well, which is displayed on your screen. You can call any of them. Let's talk. Let's see what is happening. Let's see what we can do to help you. You have a kind of Past Post Office, which me I follow you as well. Facebook, Royal Natural Health and Wellness Clinic, which me I follow you. TikTok, Royal Natural Health Clinic, which me I follow you. Instagram, which means we are following Twitter. That's X, which me follow with Royal Natural Health and Wellness Clinic. No, when you key in now, you're going to see us. Just follow us. we give frequent discussions, frequent topics. You can just talk. This Christmas, we want you to live well, we want you to live healthy, and so we recommend the best for you. I recommended Dab Farms whilst I was talking, and they are into chickens, and they are into turkey, they are into other poultry products. So kusuya ni bibia onye bia no, utumi efro mo ewo phone so utumi koko den ekoto mo nyamen before Christmas. Says in kind as that is nkoma City Gold, bro nyebe to bibiche wa downfo, to bibiche wo hokafo. To be biche or software, to be biche obia, I feel now the person has been good to you. Omo makola, komokola to bibi, say watch, say back chain, say bibi biano, and their things are subsidized for this Christmas. No kona koto bibi. O to catch on some on pasama. Now actually nipan fine. Because said our class now they are commanding pan so Christmas. Manipanin dress it during the Christmas. Men found commanding Christmas no to me turning them. Send your Christmas wait to me their dress and I'm going picture. So what I say, as that can say, and command the entire crew that helped me today, to Efodas Gideon, to Akoto, to Tio, and then to my crew, that is Philip, Abigail, and then today we had Dr. Deborah visiting us. Doc, we've missed you. I'm sure say our next visit, you're going to be on set with us as well. Tino that send ne be share near Bonkomodia, Mejiso, Joel Aidaneso, Macramo.